po tayo sa ating Nutrition and Health Webinar Series Episode 7. Samahan niyo po kami for the next hour. This webinar series is a community service brought to you by Pharmaceia Jimenez Corporation. Our today's sponsors are Setyl Feminine Wash for Pregnant Women and Cellife Cellular Nutrition Tablet. I'm Dr. Grace, and I will be with you for the next hour of this webinar. Ang topic po natin ngayong hapon ay healthy pregnancy during quarantine. According to an online article published on July 2020, experts say na they're predicting a baby boom until the end of this year due to the community quarantine. In fact, according to this article, mas malaki pa daw yung magiging result nitong pregnancy na to compared dun sa highest number of births sa Philippines na naitala noong 2012. Ini-expect natin that this quarantine, mas maraming mabubuntis, maraming buntis. Kaya lang, may tanong din tayo, how do we ensure that they will have a healthy pregnancy during this quarantine time? I'm sure lahat ng mga nanay na nakikinig ngayon this afternoon will agree with me dun sa kasabihan natin that a healthy pregnancy means a healthy baby. Kaya lang, dahil sa limitations ng panahon ng community quarantine, mahirap na tayong pumunta dun sa ating mga OB-GYN o sa mga doctors natin for prenatal check-up para gawin yung mga dati nating ginagawang activities na before this community quarantine. Yun yung mga challenges and difficulties that most pregnant women are facing now. So para po bigyan tayo ng kaalaman at tips ngayong hapon na to, ang episode nating healthy pregnancy during quarantine, makakasama po natin ang isang dalubhasang doktor na isa pong fellow ng Philippine Obstetrical and Gynecological Society. Isa rin po siyang fellow ng Philippine Society of Ultrasound in OB-GYN. Siya rin po ay isang active consultant ng Medical Center Muntinlupa, UniHealth Southwoods, and Santa Rosa Hospital and Medical Center. She is also an extensive community-based medical practitioner in Muntinlupa together with her husband, Dr. Rolando de la Merced, na isang pediatrician, and they are managing the De La Merced Maternity and Children's Clinic. She is a mother of two. Magandang tanghali po o hapon po, and we're so privileged and blessed to have you with us as our resource speaker, Dr. Jimenez de la Merced.
Magandang tanghali po sa inyong lahat. Isang maulan na tanghali. Grace, I want to correct you. I'm a mother of 6.
Oh, 6. I'm sorry for that. I'm sorry.
And my youngest is both girls. They're twins.
Oh, kaya yun ang nakita ko na mention. I stand corrected, Doctor, for that. I'm sorry.
It's okay. It's an honor actually to be introduced as a mother of 2. Well, magandang hapon po sa lahat ng ating nanonood sa webinar na ito. And I would like to thank, firstly, our sponsor, the Pharmaceia Jimenez, in behalf of Grace, of course, and the company itself. This is my first time to be of service in the community during this pandemic. Actually, I've been longing to have this lecture. Sana kaya lang I didn't have the chance kasi nga to go out is bad for us. So I think this is the safest way to share what is a healthy pregnancy all about. So can I start now?
Doktora, introduce ko lang kasi dahil itong hapon na to, we also have live viewers from our FB Live and our YouTube Live po. This will become a mother's class for everyone. So nag-invite na rin po tayo ng 2 female guests natin. One is pregnant and the other one kakapanganak pa lang po, so that they can also ask you questions later and then share their personal experiences during their pregnancy ngayong quarantine period. Introduce ko lang sila very quickly, Doktora. Yung ating first mommy guest, she is actually a marketing manager of a BPO company currently working from home. She's 31 years old. Meron na po siyang isang anak, but she's actually on her first trimester, 8 weeks yung kanyang pinagbubuntis. Welcome, Mommy Joanne Ruiz. Hi, Mommy Joanne. Say good afternoon also to our live viewers there.
Good afternoon,
Good
everyone.
afternoon. And of course, to our guest resource speaker, Dr. De La Merced. And ang second mommy guest naman natin, she just had her delivery last June. She is a nurse by profession and a school nurse po sa isang Montessori school in Ayala, Alabang. She is also a wonderful wife to our very own Abel, and she is going to join us para ma-share yung kanyang personal experience nung nagbubuntis siya during quarantine. So, Doktora, without further ado, let's proceed to your, I'm sure, very exciting and informative presentation this afternoon.
Actually, a very beautiful title. No? It's a healthy pregnancy during quarantine. Okay, so first slide. So like the old saying goes, a healthy pregnancy means a healthy baby. So ito po yung gustong-gusto nating malaman. It's a delight to all of us that once we get pregnant, we see our baby healthy, no, upon birth. Next slide, please. So how do you diagnose pregnancy? Pregnancy is usually identified when a woman presents with symptoms and possibly home urine pregnancy tests. The symptoms and signs, amenorrhea or absence of menses in a healthy reproductive age woman who previously had experienced spontaneous, cyclical, predictable menses is highly suggestive of pregnancy. So ito po yung pag tumigil na ang regular nating cycle, suspicious na po tayo na baka tayo'y buntis, no? So occasionally, uterine bleeding that mimics menstruation is noted after conception. So most of my patients, they will tell me my last menstrual period was this one, where actually they are pregnant at the time. So some patients will go to the clinic because they have already the perception of fetal movement. Malaki na pala yung baby.
Mm-hmm.
No, the third. The picture. Transfer the picture. And the third one, these are the changes in the lower reproductive tract. And some patients would also complain of breast tenderness. So these are symptoms and signs of early pregnancy. Okay, next slide, please. So now we are prepared to go to our checkup, the initial prenatal evaluation. Ano ba yung goals natin? Why do we want to go to our OB-GYNs? So number one, as an obstetrician, I would try to define the health status of the mother and the baby. So I will check the mother, check the vital signs, check the physique, interview her, get a complete history of the previous illness, any exposures, what is the profession of the mother, any intake of substance or any intake of vitamins or any intake of medications that will be help in justifying this is your health status now. So I will try to estimate also the gestational age based on the last normal menstrual period that she will give me. And of course, the last will be to initiate a plan for continued obstetric care. So the normal pregnancy duration is calculated from the first day of the last normal menstrual period. And this is very close to 280 days or 40 weeks. So how do you estimate of a pregnancy due date? So do we have mommies? I believe we have mommies here who are pregnant. So you can go with me in calculating your age of gestation. So we call it Nagel rule according to the American College of Obstetrics and Gynecology. So think of your last normal menstrual period now and follow me. So you add 7 days to the first day of the last normal menstrual period and subtract 3 months from the month. So example, the last normal menstrual period was October 5. So you compute for the estimated date of confinement. October means that's the month, so you deduct 3. So 3 months prior to October is July. And then from the date, which is 5, you add 7. So that will be equivalent to July 7 of the following year. Are you with me? Hopefully you're with me. So this is the easy calculation of your age of gestation. So the trimesters is divided into 3. So the first trimester, it extends through 14 weeks. The second trimester until 28 weeks. And the third trimester is 29 to 40 weeks. So what do you want to hear from the doctor? So your doctor now tells you, oh mommy, ang iyong pagbubuntis ay okay na okay. Si baby ay very healthy. Diba that is a good music to our ears? Unless, syempre, if you go to the doctor na medyo problematic ka na, the doctor will tell you step by step kung paano niya sasabihin na magiging maayos ang iyong pagbubuntis. Okay. So a little lecture only on the trimester. So the first trimester, as I have said, this is weeks 1 to 14. So as you can see on the upper right-hand corner of the slide, you have the transvaginal picture. You don't see the baby there. You just see the small sac, and it's a gestational sac, what we call it, by ultrasound. This is the most critical stage because all major organs begin to form. Ito po yung tinatawag na organogenesis. So ito po yung critical stage na baka makunan, yung mga threatened abortion. So that is why when you go to the doctor, sasabihin niyan kaagad, oh, let's do transvaginal ultrasound. Ito po yung malocate natin yung pregnancy if it's on the proper location. Baka po kasi ectopic. Ito po yung we will see if there is already a viable embryo. Baka po kasi missed abortion. And this is also to check if there is a subchorionic bleeding. Baka po kasi makunan si mommy. So this is also called critical. I always say it to my patients, critical yan, mommy, because the first 3 months you will never know. Because you are facing hardships, parang you are not in good shape, parang madalas kang magsusuka, mahihilo, ayaw mong kumain, and you are craving for some foods. So most of the parents, most of the mommies, they don't like to go to work. Magpapa-medical certificate pa yan because they are not feeling well. So this is the critical stage talaga na they need support, they need your supplements, they need your advice. So the baby now receives good and harmful substance from the mother. So kanina sinabi ko, from the very start, magi-interview, magi-history taking. So one important thing is, ano ba yung iniinom mong gamot? Baka mamaya merong something na hindi dapat sa pagbubuntis. O baka mamaya you are cigarette smoker, or sometimes you drink alcohol. So these things must be extracted because all these things pass through the umbilical cord. The heartbeat can usually be seen around 6 weeks via ultrasound and heard around 9 weeks via Doppler. So the second trimester, ito na po yung medyo magaang-gaang na because the nausea and vomiting should usually end by the 16th week, no? Tapos na po yung maglihi. So makaka-start up na naman yan. May momentum na yan to go back to the work. Na? So starts at the 14th week and ends at the week of 28 weeks of pregnancy. Ito po yung trimester na malaki na yung uterus natin. Nafe-feel na natin siya. May bump na tayo. And one good thing, nararamdaman na po ng ibang nanay na medyo may quickening na siya. We call it quickening. Usually ito po ay nararamdaman ng mga first-timer na mommy at 20 weeks gestation. Yun naman po mga second, third, fourth, fifth pregnancy, mas earlier po yan, mga 16 to 18 weeks, may feeling na sila ng quickening or paggalaw ng baby. So again, we do ultrasound on the second trimester. Bakit po? Kasi we monitor the growth. Baka mamaya ito na yung simula ng hindi maganda o hindi nagiging appropriate yung growth ng inyong baby. And you will also hear yung mga congenital anomaly scanning this time. This is the appropriate time to do that because this is the time na magmamanifest na po yung mga congenital defects sa baby. So it seems that during the second trimester, ito na yung lumalaki na yung bata. So remember sa first trimester natin, organogenesis, organ formation, lahat yan. By second trimester, meron na po yan, naka-set na yung organs na yan, nagpapalaki na lang po yan at nagmamature. So the third trimester starts at 28 weeks and ends at birth, which is 40 weeks. That is the standard. Age of viability, most babies could survive if they were born around 28 weeks. But this is medyo nakakatakot po kung magsisilang kami ng 28 weeks. Kasi very premature po ang lungs niyan, ang brain niyan. And the baby would hardly survive without the NICU or without the incubator and oxygen alalay, no? Tsaka mga gamot. In reality po, wag nating isipin na 7 months is better than 9 months. Kasi I've been hearing parents na, Doc, mas mabuti pa nga raw, not 9 months, 7 months kesa po yung 8 months pala. That is not true. Of course, the closer you go into term, the better, no? So ito po mga preterm babies na to ay naiiwasan naman ang panganganak. As I've said, kung meron silang regular prenatal visit sa kanilang doktor. So by third trimester, baby is fully developed and just needs to grow and mature in order to be ready for its big debut. During the 9th month, the placenta, ito po yung inunan, provides antibodies to help protect the baby and the lungs are now mature. Next slide. So how do you maintain a healthy pregnancy? Ito na nga po yung prenatal care. So ito po yung doktora na nakikinig sa heartbeat ng baby. Ngayon po hindi na stethoscope ang gamit. Doppler na po yung pampakinig natin ngayon sa heartbeat, no? So pagpunta sa doktor, lagi pong hina-heartbeat, pinapakinggan kung yung heart rate ay okay, yung rhythm ng heart ng baby is okay. And then we measure also for the fundic height or the size of the abdomen if it is appropriate for the age of gestation. The prenatal checkups will help your doctor carefully monitor you and your growing baby throughout your pregnancy. It will also give you a scheduled time to ask your doctor about any concerns you're having about your pregnancy. And this one, the prenatal checkup also will set up a schedule with your healthcare providers to manage all your symptoms and questions. Now we go to immunization. This is part of the prenatal visit. Lalo na po ngayong panahon ng pandemic, dahil yung mga pasyente natatakot pumunta sa doktor, natatakot pumunta sa hospital, baka sila'y mahawa, no? But please do not miss the regular immunization. Baka po for some time kami miss ng mga immunization na yan. Pagsimula naman tayo ng pandemic. Remember ang polio natin na eradicate na. There was a time na nauso na naman siya. So where in fact available ang oral polio vaccine and inactivated polio vaccine sa ating mga babies. So talagang nakakalimot lang po. Yun po ang wag natin gawin ang i-miss ang ating immunization. Prevention is still better than cure. No? So the influenza, the table here, you have the influenza or inactivated. Ito po yung usong-uso nga yung vaccine, no? Dahil po sa nag-uso na nga ang COVID natin, and COVID is manifesting as influenza as well, na para kang nilalagnat, may trangkaso, may sore throat, may sipon. So karamihan na po ngayon nagpa-vaccinate. Parang this is the first time in my history as a doctor, napakarami ko pong nabakunahang flu because of the fear of COVID, mapagkamalang silang COVID, no? So pregnant women should receive the influenza vaccine. Yearly po ito. The TD or tetanus toxoid or Tdap. The Tdap po is tetanus, diphtheria, and cellular pertussis. This is 3-in-1. Binibigay na rin po ito sa mga pregnant women. We usually give it at 26 weeks until the 36 weeks age of gestation. Bakit po? Kasi ito po ay protection. Ang mami po, pag binakunahan natin ng Tdap, no? Sa tiyan pa lang niya, ang baby po ay napapasahan niya na ng antibody. Ito po ay dumadaan sa placenta. So paglabas po ng baby, namana niya na o nabigyan na siya ng kanyang nanay ng antibody against these 3 diseases. At the time naman po na 2nd month or 3rd month na ni baby, yan naman po yung time na tatanggap na siya ng DPT. Okay. The MR or MMR is not given. It's the rubella vaccine. HPV, this is the cervical cancer vaccine. It's not given. Varicella, it's not given. Chickenpox po yan. Pneumococcal, depende po kung may pangangailangan. Hepatitis A, depende rin kung may pangangailangan. Hepatitis B can be given. Sa buntis po, binibigay namin yan, especially so kung high risk siya o kaya po yung kanyang antibody is negative. Zoster vaccine, we don't give it. Okay, next. Nutrition. So, ito po talaga magbibigay sa atin ng lakas ng katawan natin, no? Lalo na ngayong panahon ng pandemic. So, nutrition, a nutritious diet during pregnancy is linked to good brain development. Agree tayo lahat dyan, di po ba?
Yes.
And a healthy birth weight
Yes.
and can reduce of many birth defects. A balanced diet will also reduce the risk of anemia, other unpleasant pregnancy symptoms such as fatigue and morning sickness. A well-balanced pregnancy diet includes protein, vitamin C, calcium, fruits, vegetables, iron-rich foods, adequate fat, folic acid, other nutrients like choline. Next slide. So the weight gain, gaining weight while pregnant is completely natural and expected. Of course, pag lalaki yung tiyan mo, lalaki si baby, lalaki ka rin. Kaya lang, not all pregnancies naman, not all mothers will be able to gain the expected weight gain. No? That is why we need to have our regular prenatal visit para tayo mapayuhan kung hanggang kailan, hanggang anong timbang ba ang dapat mong i-gain. No? So it's important to discuss and monitor your weight and nutritional needs with your doctor throughout your pregnancy. Weight gain recommendations will vary for people who are underweight before conceiving, for people who have obesity, and for those with a multiple gestation pregnancy such as twins. So again, ito po yung sa right-hand corner ng slide natin. Yung breast po natin, lumalaki yan by 2 to 3 pounds. Yung baby po natin, malaki na po yan, 3.5 kilograms. That is not the weight of a Filipino baby. Ang Filipino baby po, nagre-range lang sa mga 2.5 to 3 kilos. So, placenta po, 2 to 3 pounds, or equivalent to 1 to 1.5 kilogram. The uterus po natin, 2 to 5 pounds, amniotic fluid, and so on. No? We have a table here. This is the recommendation for total and rate of weight gain during pregnancy. So pagka ang mami po nagpunta sa clinic, titimbangin po natin yan. No? Aalamin natin yung height niya, aalamin natin yung pre-pregnancy weight niya. So I have here the category of the BMI. BMI po is the body mass index. Ito po yung calculation ng height according to the weight, and the equivalent BMI will be reflected. Naka-table na po ito. So once the mother's height and weight is taken, itatabulate po natin yan. Kung lalabas po sa table ay less than 18.5, please see the table, no? 18.5, so underweight po siya. So that what will be the advice? O ma'am, ikaw po ay underweight, so you need to gain this weight. The total weight gain expected of you for the entire duration of your pregnancy is from 28 to 40 pounds. Okay. I think, Grace, tayong dalawa, ay hindi siguro, hindi tayo underweight. Normal weight tayo. Pang normal weight tayo. Hindi ako na underweight. Normal weight, you have a BMI of 18.5 to 24.9. So, yung mga normal weight mami po, they should gain 25 to 35 pounds for the whole 9 months of their pregnancy. Yung mga overweight naman po, dapat mga 15 to 25 yan. At yung mga obese po ay 11 to 20 pounds lang. So ito po, nakita nyo, hindi pare-parehas, nagtataba ng ganon. So wag po magkukumparahan ng mga mami, no? Iba-iba po tayo. Next. So the prenatal vitamins, most nutrients needed during pregnancy. Sorry, I cannot see the slide. The pictures are, okay, should come from food. But prenatal vitamin supplements play an important role to fill any gaps. It's hard to consistently plan nutritious meals every day. Kaya po kailangan may supplement tayo. Folic acid or folate is a B vitamin that is very important for pregnant women. Folic acid supplements taken several weeks prior to pregnancy and for the first 12 weeks of pregnancy have been found to lower the risk of having a child with a neural tube defect such as spina bifida. I-add ko rin po dito, the folic acid is very important. Bago po magbuntis, some newlywed couple will approach me, Doc, we just got married and I'm planning to get pregnant by this month. So ito pa lang po, i-advise ko na siya, o sige, uminom ka na ng folic acid. Why early? Because folic acid supplementation is also preventive mga cleft lip and cleft palate. And aside from the spina bifida. So it is very helpful po talaga. So hindi po yung dadating. Mas maganda po yung bago dumating, nagplano na po, no, kesa yung mga unplanned pregnancy, yun po ang medyo mahirap nating habulin na eh. So choline is another vital nutrient that may help prevent birth defects of the brain and spine. Most prenatal vitamins don't contain much or any choline. So kaya rin po tayo nagpapa-check up dahil after din tayo sa brain development ng ating babies, right? No? Marami na pong lumalabas ngayon na supplement. Nag-advertise sila for development of the brain, for the memory and cognition of their babies later on in life. So, Cellife, patalasta, syempre, this is our sponsor for today. Cellife, hindi ko naman po talagang pinopromote sa inyo to ngayon, pero ito pong nagbigay sa atin ng buhay for this afternoon. And honestly, I've been using Cellife for several years, no? And it's been very beneficial to all my pregnant patients, especially given sa mga babies na, should I say, underweight. Pagka po nagpapa-check up and by ultrasound, the size of the baby or the weight of the baby is below the normal, then that's the time I give them Cellife. Cellife has shown its proof na talagang lumaki po, nahabol yung mga weight ng mommies. Sa mga mommies po na hypertensive, lalo na yung prior to pregnancy, hypertensive na sila. Ang mga mommies po na underweight, talagang nagsisilang po ng mga babies na maliliit. Itong Cellife po ay binibigay ko to, nakakatulong po. And I've attended several lectures also from pediatric gastroenterologists, no? Ginagamit na rin po nila ito sa mga children po na talagang undernourished. And also, I've been using this, ang practice ko po, kasi kuminsan yung mga nanay ng pasyente ko, nagiging pasyente ko na rin yung mga matatanda. They are not fully complying to the daily nutritional requirements. Also, I prescribe Cellife.
Thank you, Dr.
Yeah, you're much welcome. Exercise. ACOG recommends aiming for at least 150 minutes. So this is roughly 20 minutes a day, no, of moderate intensity aerobic activity every week. If you were not physically active before getting pregnant, talk with your doctor about what safe exercise you can do during your pregnancy. For the majority of normal pregnancies, exercise can increase energy levels, improve health, strengthen muscles and endurance, reduce backaches, relieve constipation, increase circulation. So ito po yung mga problema ng mga buntis, no? Laging nagko-constipate, laging sumasakit ang balakang, hindi daw makalakad, nahihirapan sa pagtayo. I think they need exercise. You need to mobilize, no? Marami po tayong exercise. It need not be na talagang pagod ka. Just enjoy. Enjoy your exercise, no? Aerobic exercises such as walking, that is very good already. And some, they walk outside. They need vitamin D also. Light jogging and swimming. Ako po, nag-swim nung ako'y buntis. Okay na okay po yan. Stimulate the heart and lungs as well as muscle and joint activity, which help to process and utilize oxygen. So now we go to prenatal feminine hygiene. Why is it important? Marami pong mami, they ask me, bakit laging ang daming discharge? Doktora, okay lang po ba yung puting discharge? Doktora, okay lang po ba yung madilaw or green or parang kesong puting discharge? So it depends, no? marami po tayong pwedeng maging source ng infection during pregnancy. But I tell you, yung pagbubuntis mismo po ay talagang meron tayong leukorrhea. Leukorrhea po, that is the excessive vaginal discharge, and that is normal. Yun po ay dala ng hormonal changes natin. Excessive po ang hormones natin during pregnancy na nagpo-cause po ng talagang wetness. So hindi po masamang palaging mag-wash using the feminine wash, no? Again, meron po tayo coming from Pharmaceia Jimenez, ito pong Setyl, no? Feminine wash. Hindi po to endorsement, sinasabi ko lang po. But this is good. Honestly, this is good. This is you can take your own feminine wash, but this Setyl is intended for buntis po talaga. This is mild at nakaka-prevent po siya ng mga vaginal discharge po, and most especially UTI. Yung UTI po kasi very common. That is the most common infection among pregnant women. Kung meron pong asymptomatic COVID, meron din po tayong asymptomatic bacteriuria, na UTI po yon. So when you go to the clinic, initial check-up, ay nako, magpa-urinalysis ka na. More likely than not, you have a symptomatic UTI and you are suffering from it, no? If you don't treat that UTI later on, magiging UTI po talaga yan. You will feel the difficulty in urinating, masakit po yung puson, we call it acute cystitis. And again, if left untreated, aakit na naman yan sa kidney, magiging pyelonephritis. So, ito po yung kasimple-simpleng asymptomatic na kapag hindi po napigilan ay magiging pong grabe, no? So, yung UTI po, yan po yung ginagamot during pregnancy, pero yan din po yung nape-prevent by frequent washing. Just like yung ginagawa nating protocol natin ngayon, frequent and thorough washing of our hands, ganun din po, frequent and thorough washing of our perineum. So, the feminine hygiene is also will prevent us from getting into premature contraction. Kasi if you have vaginitis or infection ng vagina, you have UTI, this may lead to premature contraction, leading to premature delivery. So yung mga infection po, yan po ang culprit kung bakit nanganganak ng maaga si mommy, no? So prevents excessive vaginal discharge. So what to do? Eat the right food at the right amount, low sodium and low carb. Drink plenty of water. Alam na po natin to, no? Inom ng tubig para madalas tayong mag-urinate at yung urinary tract natin ay maging sterile, no? Malinisan. And choose the right feminine wash. Schedule of prenatal visits. I would like to tackle this kasi nga po nagkaroon tayo ng problem with our check-ups, no? Na-disrupt. Nawalan tayo ng pagkakataon na basta na lang pupunta. Dati basta na lang pupunta sa doktor, huhulihin yung doktor kung nandyan. So traditionally, ang schedule po natin ay 4 weeks interval until 28 weeks. So hanggang 7 months po yan. Pagdating po ng 8 months, every 2 weeks na. And then weekly thereafter until you give birth. Pero now we come to the, sabi nga, always hear the new normal. This is the new normal, no? Yung tradition po natin, 12 visits tayo dyan at the most, or even more than 12 visits to our OB-GYN. But now, with the new normal, we reduce the number of visits. Bakit po ni-reduce natin yan? Otherwise, kakalat po ang virus, no? So, nililimit natin yung visit natin sa doktor. We call the doctor for an appointment or scheduled visits bago tayo magpunta. We have this interview na over the phone kung anong nararamdaman mo. And kung binigyan na kayo ng schedule, when you go to the clinic, you need to sign a declaration health form, no? So ito po yung mga suggested modified antenatal schedule natin for low risk. So remember, this is low risk. Iba naman kasi yung check-up ng mga high-risk pregnancy. So yung face-to-face consultation, no? Pupunta sa clinic, nag-schedule, nag-declare, wala siyang sakit. First 12 weeks, yung sabi kong kaninang critical stage yan. And then can be followed 20 weeks na ulit. And then 32 weeks na ulit. 36 weeks na, and then 37 to 40 weeks. So pagka po sinuma total mo to, this will turn out to be 6 checkups only, no? Pero dito po, every visit, i-maximize na yung ultrasound, yung laboratory examination, yung vaccination. Now, what happens in between when you don't see the doctor face-to-face? You can have, if the doctor is practicing telemedicine, pwede ba by telemedicine? Pwede ba by phone call? Pwede ba by video call if I have concerns? Yes, you can do that. You can ask your doctor. So the reason why we do this is, number one, we want to diminish our chances of getting the COVID or the exposure to virus. We want to observe social distancing in the clinics. At saka isa pa po, kung minsan, understaff na po tayo dahil ang mga tao wala na, no, nagkakasakit na. Kaya nililimit na po natin yung pagpasok din ng mga staff natin para sila ay magpagaling. At saka nililimit natin yung magkaroon tayo ng crowding inside the office or in the clinic. Now we go to COVID-19 and pregnancy consideration. According to CDC and prevention, pregnant people might be at increase for severe illness from COVID-19 compared to non-pregnant people. All of us, we have the same chance, no? The same chances of exposure in contracting the disease. Kaya lang, when a pregnant woman contracts the disease, she might be at a risk na maging mas severe po siya because of the some changes of the hormone, or we call it immunomodulation, no? Yung nagbabago po yung immunity niya somehow decrease dahil siya ay buntis. So delikado po yung mga pregnant na magkaroon po ng COVID. Additionally, there may be an increase of adverse pregnancy outcomes such as preterm birth among pregnant people with COVID-19. So actions, what to do if you are pregnant. Do not skip your prenatal care appointments. Limit your interactions with other people as much as possible. Don't go out if you're pregnant, please, no? Lalo na po pagka manganganak, malapit ng manganak, do not go out because pagka kayo nagkasakit, wala pong tatanggap sa inyong ospital na available. Lalo na ngayon, marami na pong nagsarang hospital, punong-puno na po ng mga COVID patients, no? Just before this webinar, one patient called me and she's going to the hospital, but unfortunately the hospital is not open anymore for her. So naghahanap na naman kami ng ibang hospital to accommodate her. She just gave birth 1 week ago. So ito pong ginagawa natin na ito na pag-limit sa interaction, ito po ay responsibilidad na natin sa ating sarili para naman yung ating papunta sa hospital na time na manganganak na tayo, hindi po tayo magkaroon ng problema. Take precautions to prevent getting COVID-19 when you do interact with others. So wear yung face mask natin, no? Tsaka tayo hand washing, using alcohol, and maintain social distancing 1.5 meters away. Make sure that you have at least a 30-day supply of your medicines, of course. Take vitamin C. Take vitamin zinc also. You can take it daily. Talk to your healthcare provider about how to stay healthy and take care of yourself during the COVID-19. So learn more about how to reduce your risk of getting COVID-19. Next slide. Grace, I would like to, this is actually not part of the healthy pregnancy, but I would like to take this opportunity to talk about this law. This is the RA or Republic Act 11332. And this is telling us that we have to notify yung ating mga barangay, yung ating CHO, yung CESU or RESU, if we find somebody that is positive. So this is an act providing policies and prescribing procedures on surveillance and response to notifiable diseases, epidemics, and health events of public health concern. Sa ngayon po, itong hindi po epidemic kundi pandemic, ito po ang tinutukoy nito ay yung ating COVID-19. So yung mga pasyente ko po na I have tested them positive for swab, buntis, no? I am the one responsible to report them to the nearest barangay for monitoring. So don't be offended mga mommies. It's just a public concern para po naman tayo lahat maging protektado. Pag hindi ko po ito ginawa o hindi ginawa ng doktor ninyo, we are held liable. Eh, mura lang naman po ang penalty, 20,000 to 50,000.
Pag
Saka
hindi
pwede
po
po kaming makulong 1 month hanggang 6 months. Mawawalan kayo ng doktor. And,
accomplice si Doktora.
yeah, and same way, it's your responsibility
Personal
to no,
responsibility.
di mga buntis, if you're positive, don't hide from us. Kailangan namin kayo, magsabi kayo na positive. And it's also your obligation to tell us if you are sick. Para po naman kayo nababantayan din namin. No po. Kami po yung nahihirapan na rin maghabol ng mga COVID positive sa totoo. In as much as we want to stay at home, we want to really help out and go out. Dahil ito po ay talagang trabaho lang. So yung mga mommies po, when you go to the clinic, triage po talaga. Triage. Don't be offended. Vigilant po tayo. Just wait outside. We will take your temperature. Somebody will interview you. Ma-interview you and you will just take note of the checklist. Yes or no lang po ito. Be honest because ito pong RA 11332, this is also about honesty. If you don't declare yourself true to it, you did not follow the checklist na you are actually saying no and yet you are yes. You have cough, you have fever. Naku, pag nahuli po namin kayo, kasi kasama din po kayo dito sa liability na penalty at kulong. Dalawa po tayo dito magsasama behind bars. No? Kaya po medyo ingat. This morning, I heard a collaboration coming from the Philippine College of Physicians, PMA, the Philippine Nurses Association, and the what do you call this? The group of PGH, Association of the Physicians in PGH, they are clamoring for the frontliners to medyo time out daw muna. Time out. They are requesting for an ECQ actually. The facts that we have, the daily facts na ang census natin, 2,000, 3,000 cases a day, it's really alarming. Hindi po tayo talaga controlled, no? Mas madami pa po tayo ngayon. And responsibility po natin yan to our community. So these people, kanina, they will ask the national government daw for another ECQ. I think if that would be of good help, why not, no? Kasi po pagod na rin po ang mga doktor, pagod na rin po ang mga nurses, masyado na rin po talagang exhausted. Ako po nakakailang quarantine na rin po ako sa exposure ko. Masakit po maswab. Ayoko na talagang maswab. Napakasakit maswab.
Sa throat.
Yeah, so to all mommies, I hope you like this short ba to o naging long na tayo. Pero
Very important.
now, yeah, thank you. Thank you for listening. And I hope I have shared a little knowledge of mine to you. Thank you.
Thank you, Dr. Jemary. That was not a little, that was a lot. In fact, punong-puno siya from prenatal. It's actually prenatal indeed. It's a mother's class indeed, I would say. No? Ako, I'm a mother of 3, but yung hearing all this now, masasabi ko, Doktora, na punong-puno tayo ng information this afternoon. In fact, hindi lang yung prenatal lang diniscuss ni Doktora, yung importance ng ating subjecting ourselves to the authority, lalo na kung meron tayong symptoms of COVID, is very important. Dun sa sinasabi ni Doktorang, COVID really is still on the rise. Tuloy-tuloy. Parang Netflix, when we think that it's over, another episode is coming. Di ba po, Doktora?
Yeah.
I think, hindi lang siya naging prenatal class. It's really an involvement and our accountability.
I asked Abel if I can include it because I'm really touched by the people this morning.
Oo, Doktora. Actually, we appreciate you. We value you for the contribution that you do to the community. And itong community na service na ginagawa natin by doing this information drive is doing a lot to our fellow Filipino people na sabi nga natin, because of the limited access of going to the medical clinics and seeing our doctors, yung ganitong information that we can bring it to their houses through via FB Live and YouTube Live, I think it's a great contribution coming from a doctor like you. Salamat po, Doctor.
Thank you, Grace. Thank you
so much. So, punta na tayo. I'm sure si Miss Joanne muna tayo. Si Miss Joanne is on her 8th week of pregnancy. Bago ko tanungin si Miss Joanne yung tanong mo kay Doktora, no? Papasalamatan ko lang po yung mga nanonood. Of course, our very own Dr. Rolando de la Merced. Thank you for watching. And
he's watching.
Para pasensya ka na, hindi ka kasi mukhang mommy of 6. You only look like mommy of 2. So si Dr. Beng Valero, si Dr. Rowena Andres Pua, of course our medical director, Dr. Molina Briones, our last week's speaker, Dr. Miguel Lumawig, Dr. Arnold Alvarez, Dr. Mia De Jesus, Dr. Marie Vinang, Dr. Speedy Bagal. Ang daming nanonood nating doctors ngayon. Salamat po. And from Pasig Children's Medical Staff and Ma'am Carmela Evangelista, salamat po for watching. So Doktora, marami tayong nakikinig na heroes, mga health workers and doctors also. Salamat po for watching. Yes, Mommy Joanne, can you share to us your personal experience and feel free to ask our doctor about your question on your 8th week of your pregnancy.
Yeah, because Doctor, nalaman ko lang recently na I'm pregnant. So it's around 6 weeks. So I'm taking prenatal vitamins already for 2 weeks. And then I'm just concerned if meron bang possible na parang sinasabing suggested dosage of prenatal vitamins na kailangan for every pregnant women. And yun nga, pagka sumobra ba, what will happen?
Okay. First thing is you are on the first trimester, right? So yes. Folic acid is very good. 4 microgram to 8, actually it's 400 to 800 microgram of folic acid is good.
Okay. But for the rest of it, for example, additional vitamins.
First, the folic acid is very good during the first trimester. And then the additional supplements, yung ating mga multivitamins na and minerals can be added. Calcium is given separately because some of the multivitamins, it doesn't contain the right amount of calcium. We need 1,200 milligram of calcium. Any form, pwede siyang calcium carbonate, calcium citrate maleate, no? It depends. Pero ang pinaka-cheapest talaga ay calcium carbonate. And it is always available in the market. So 2 tablets, you can take it 1 tablet twice a day. So bukod yun sa multivitamin, separate yung calcium. Another bukod na vitamin is your ferrous sulfate. Kasi yung ating multivitamins naman, sometimes it doesn't contain enough or the recommended daily allowance is not met on that multivitamin. So we need extra ferrous sulfate na naman. So dapat, depende rin sa timbang mo yan, so 30 milligram per kilogram per day of ferrous sulfate. So these things, sinusupplement talaga yan. So actually, hindi mo sabay-sabay iinumin yan, Han, kasi yung ating mga calcium should be taken after meal, yung ating ferrous sulfate should be taken on an empty stomach. Kasi pagka pinagsabay mo yan, the absorption of ferrous will be diminished. So, yun. And some preparations would already include folic acid, baka pwede na rin yun. Need not separate it, no? Some preparations, kung talaga may high dose yan na calcium, pwede na rin. Lalo pa kung umiinom ka ng gatas, yung ating mga mother's milk, so pwede na rin yon. Make sure you know how to calculate. Kasi kung talagang kulang, hindi ka naman umiinom ng gatas, tapos yung multivitamins mo, tingnan mo yung label.
Yes.
Always check for the label. Just like when you go to the grocery, di ba? You check the label. Nandun din naman yung caloric intake natin pagka kumain ka yung serving. So makikita mo dun yung mga, minsan meron silang sinasabing total energy, calorie, may fats pa doon. So, machi-check mo yan. But for us obstetrician, we assume na itong mga mommies na to talagang hindi tama, hindi kayang kunin sa pagkain lang. Kaya talagang there's a need for additional supplementation.
Okay po. Thanks, Doc.
I think si Mami Joanne also is working from home. Tama, Mami Joanne?
Currently po, working from home ako. Pero I'm just concerned when yun nga, since may pandemic pa, and if we're parang nire-require na to go back to office, if it's recommendable ba for pregnant women?
Yes, you can go back. It's up to you. Marami nang humingi sa aking medical certificate to certify them that they are healthy, they are free from COVID. Yan ang sasabihin sa iyo, Doktora, need po rapid test, Doktora, need swab. Sabi ko, what's the purpose? Can I always assure you na I cannot be with you all the day na masasabi kong negative ka. What about if you go to work, may nakausap ka na pala? For the time being, then you are okay. Just take extra precaution, no? Hindi natin pwedeng itigil ang mundo natin eh. Talagang kailangan nating magtrabaho. Kaya lang, be very careful. As I have said, pregnant women are really serious patients when it comes to COVID.
Okay po, Doc. Thank you.
So, Joanne, I'm sure nasagot ni Doktora lahat.
Yes.
Mo, no? Si
Ay, matutulog ka rin ha, kasi kung night duty ka, take a rest 8 hours a day ha. Make sure to bawi.
And si Joanne is also a mother of a 6-year-old son. Tama ba, Joanne?
Almost 6. It's 5.5. He's 5.
And
Yeah.
married to a very active triathlete also, si Jordan. Hi, Jordan. So, very active yung kanyang family life. So, tamang-tama, Doktora, yung kanyang pag-guest sa atin because of her personal experience. Balik ako sa iyo, Mami Joanne. Yung another naman guest natin in the house, Doktora, inabot siya ng quarantine ng kanyang pregnancy, but she gave birth last June. But she would also like to ask you about her postpartum concerns and, I don't know, personal experiences during si Mami Carrie. Mami Carrie Gomez. Mami Carrie.
Hello, good afternoon, Ma'am Grace, Dr. Jemari. Thank you po for the information you've shared to everyone. Doctora, I'm just concerned regarding postpartum, and as for having sleepless nights as well, then also taking care of my 6-year-old son. What would you advise for regarding my diet or any supplement to keep me fit and well?
Are you on breastfeeding?
Yes.
Yes, ma'am. Yes,
Okay.
Tara.
So I always emphasize mommies to breastfeed, no? Lalo na ngayong pandemic, kailangan tayong magpasuso ngayon. Bukod sa mahirap nang bumili ng gatas, mahal na mahal ang gatas, lalo pa kung walang trabaho, no? So pagka ikay nagbe-breastfeed, I will say continue your calcium supplementation, twice a day pa rin, and your ferrous sulfate. Kailangan natin yan for the first 6 months. Kasi we exclusively advise breastfeeding for the first 6 months. Multivitamins, you can also take it if you like. But calcium and iron, this is very crucial to take. No?
Thank you,
Mami
Doctor.
Carrie. Oo. Doktora, i-mention ko lang, sa practice mo ba, because you mentioned a while ago that you're also using Cellife tablets, salamat po. Do you also recommend food supplementation, especially kung ang pasyente mo is a breastfeeding mom? Kasi, di ba, sabi nga natin, garbage in, garbage out. Kung ano kinakain ng nanay, yun din ang nilalabas. Do you also recommend food supplementation during breastfeeding sa mama?
Yes, I do. Especially nga if they don't meet their regular intake, yung mga hindi na nakakakain ng maayos dahil nga nag-aalaga ng bata, no, hindi na nakakatulog ng maayos, I always emphasize on taking supplements. Cellife is also given even to non-pregnant, even to non-breastfeeding for as long as they need it. Kasi alam naman natin, this is protein, no? This is amino acids, the building blocks. So, kailangan natin yan talaga para tayo hindi mamayat. At saka, talagang nakita ko naman yan how these babies grow inside the uterus using Cellife. At saka yung mga pasyente ko nga na mami na payat, talagang I always advise them to continue the supplements.
Yun. Thank you, Doktora, for that. Mami Carrie, you heard it from the doctor herself. I think si Mami Carrie's concern also na she's work from home. Tama, Mami Carrie, ano?
Yes, Ma'am Grace.
Oo. Yung share mo lang sa amin ng konti yung experience mo na naka-quarantine ka while you were pregnant on your second and last trimester, I think, Doktora. Inabot siya ng quarantine eh. So,
Yes.
paano mo na maintain yung pagiging healthy during your pregnancy while naka-quarantine ka?
Everything na sinabi ni doktora during the consultation, it really happened to me talaga. Starting from March until March, April, and then the third week of May pa lang po ako nagkaroon ng consultation with my doctor due to this pandemic. Ayun, I just try to eat healthy foods all the time. It's very hard po na to go out, especially I'm pregnant and then going with other people din po. Alam kong nakasama rin yun sa health ko and with my baby. So maybe preventive measures po, I really sinunod ko po lahat ito. Hand washing, having enough sleep, proper diet. Ganun pong ginawa ko long days.
Mhm. So lahat yan nabanggit ni Doktora. Thank you, Mami Kari. Nabanggit ni Doktora lahat yon. Sabi nga ni Doktora, healthy pregnancy is
Yes,
healthy baby. So I'm sure pag nakita niyo, Doktora, yung baby ni Mami Kari, napaka-healthy. Sign na nagkaroon siya ng healthy pregnancy. Nabanggit, Doktora, kanina, sabi mo lahat, no? Importante din yung hygiene, yung personal hygiene. Sabi mo nga, pag buntis, meron tayong mga discharges na hindi regular pag hindi tayo buntis. Pero ang tanong ko, again, hygiene pa din. What about, Doktora, what do you think about oral hygiene naman? Because if you've heard about, I'm sure you've heard about gingivitis during pregnancy,
Yes.
especially on the first trimester. Meron po ba kayong personal experience na marami po ba kayong cases na nakikita na merong gingivitis during?
Marami sa pregnancy. Actually, may fear sila kung pupunta sila sa dentist. Baka mamaya mali daw yung ireseta ng dentist. No, so I said, punta ka sa dentist, patingin ka. Babalik yan dito, may request ng dentist niya na bigyan ko raw ng clearance for this particular antibiotic, for this particular mouthwash, and may clearance ba ito for pasta, o may clearance ba ito for tooth extraction. So pwede tayong magpunta sa dentist, pwede tayong mag-prophylaxis, pwede tayong magpabunot or magpapasta. Wala pong bawal doon. Mas delikado po kung itong ating gingivitis ay lumala. Malapit po yan sa brain natin. So mas mahirap pong i-treat yan during pregnancy. Where in fact, it can be prevented. May mga mouthwash po tayo na available din, no? And I know you have brains in your closet, you have this particular Oraneem.
Yeah, Doktora. Thank you for mentioning that kasi actually kaya ako siya siningit, Doktora. Yung sinabi mo na feel free to see your dentist. Katulad nyo nga ng mga doctors din in the medical field. Ang dental profession din masyadong may mga bagong protocols na rin ngayong new normal, ano. Kaya ang nire-recommend natin is really for them to practice good oral hygiene. Yung binanggit mo, Doktora, ang Oraneem mouthwash, that's actually safe because we had our own local studies done here in the Philippines in partnership with the medical doctor who's an OB-GYN also, Dr. Monina Briones. Among first trimester of pregnant women, ang nagtingin po are some of our friends from UPPGH College of Dentistry din po, si Dr. Mia De Jesus and Dr. Giselle Yumol, na tinignan natin na yung mga mommies who are suffering, pregnant moms at that, who are suffering from gingivitis, tapos po sinamahan nila ng mouthwash, tapos regular toothbrushing, na prevent po nila yung pag-progress ng kanilang gingivitis. So kaya ako po nabanggit din yon kasi sabi nga, Doktor, I don't know if you've encountered yung pasyente. Dati nung first and second trimester, first pregnancy ko, kompleto pangipin ko habang dumadami yung nanganganak ako, nauubos bigla. May ganun din po ba kayong
Wala naman.
Wala naman. Pero kasi kami, may mga ganun kwento kami na encounter. So, nabawasan yung ngipin nila. Habang dumadami yung anak nila, nababawasan naman din yung ngipin nila.
Pero they're more prone sa mga gum bleedings.
Yeah.
Nose bleeding, gum bleedings.
Oo. At saka yung iba kasi, Doktora, takot mag-toothbrush because of the taste. For some reason, meron silang dislike dun sa sa mga ginagamit nila pag buntis, yung naaamoy nila, hindi nila gusto, di ba?
Yeah.
So anyway, thank you for clarifying that na pwede silang pumunta sa kanilang mga dentista for a prophylaxis and for a pasta for restoration ng kanilang mga dental caries. So doktora, magtatanong lang din, Mami Kari ha, thank you for sharing your personal experience. May mga tanong lang tayo coming from our viewers. Sabi po ni Miss Beng Arieta, Doktora, hello po.
Hi, Beng.
Since it's pandemic and like me, I am work from home, what kind of indoor activities or exercise should I do on my second trimester of pregnancy? Thank you po.
You can do stretching in your house. Get a mat. Do stretching, leg raising, and even squatting. In the backyard, you can do gardening and walking.
So stretching exercises, gardening, doktora, no?
Yoga. Pwede rin mag-yoga, the light yoga.
Yeah. Kanina nabanggit mo, doktora, sabi mo swimming. Marami na ako nakita, marami na ako nakitang buntis na nagsuswimming. And napakagandang exercise. Thank you, doktora, for that. And thank you, Miss Beng, for throwing that question in. Si Miss Ann Sefre. Miss Ann, thank you. She's a mother of two. Buntis ka ba ulit, Miss Ann? Paano po? Hello po, doktora. Paano po ito if 2 years into breastfeeding na po ako? What supplements po ang recommended nyo? 2 years na breastfeeding.
Ako, continue. The more you continue your calcium. Because you know what? Breastfeeding can decrease your calcium level, di ba? Mommies are very prone, the pregnancy itself, yung pagpapasuso itself, the lactation, kung hindi ka nag-supplement ng calcium, baka later on in life, when you reach your menopausal states, nako, baka earlier mag-set in ang osteoporosis. So you might as well continue your calcium. Well, in fact, kahit hindi po nagbuntis, hindi nanganak, we recommend calcium supplementation. Tuloy-tuloy po yun.
Doktora, meron po ba kayong specific recommendation kung gaano katagal dapat ang breastfeeding?
2 years?
2 years.
Okay, 6 months exclusive. After 6 months kasi, they go on supplementation ng food na, pwede nang kumain ng bata. But we recommend 2 years ng breastfeeding.
2 years. So si Miss Anne should already put a period to her breastfeeding.
Pero you know what? Nako, in India, no, in India, I heard a 12-year-old baby, child is always also still breastfeeding to the mom. Ganon sila siguro dahil sa hirap nila, no? Kaya nagpapasuso pa rin sila.
Ako, doktora, yung second child ko until 4 years old, I was breastfeeding her. Buti na lang, hanggang 4 years old siya. Buti na lang naka-Cellife ako noon. Kaya 5'8" na siya ngayon.
Wow!
5'8". Maybe because of Cellife tablet. But
continue yung multivitamins.
Yeah. Doktora, meron pa tayo from Miss April Botin Ozales. Sabi niya, good afternoon po, Doctor. Watching po all the way from Bicol. Wow! Watching all the way from Bicol daw siya. I'm on my second trimester. Tanong ko lang po kung ilang tablets ng Cellife ang pwedeng i-take per day. Thank you po, Doktora.
Yes. I know what? I can give it as, I start with 2 tablets every day. I can give it 2 tablets 2 times a day. Or as high as 6 tablets a day. Depends on your doctor, depends on your physique, kung anong need mo. So, depende kung anong magiging assessment sa'yo ng doctor mo. But you can take it 2 tablets a day, perhaps with other supplements.
So,
I do not know with Grace, how do you recommend it? How much? Until how much?
I agree with you, no? Sabi nyo nga po, depende talaga yon dun sa pasyente. Kung ano yung weight niya, you mentioned about weight kanina na meron tayong sinusunod na weight pag buntis, di ba po? Tapos meron tayong mga specific requirements kung anong trimester siya ng pagbubuntis niya. Tama po ba, Doktora? So, minention niya kanina, so it's still best to consult her OB-GYN with regards to the dosaging po, kung gumagamit po siya ng Cellife tablet, we can get back to you later on para hindi naman po natin we will have to consider kung meron pa siyang ibang supplementation na ginagawa para hindi naman po tayo magkaroon ng conflict dun sa ibang binigay sa kanyang
Yeah. You consult also your attending, your OB-GYN, if it's appropriate for you. But I do not know if it's available. I hope it's available in Bicol. No?
Yes, Doktora. Actually po, ang Cellife tablet is available in Southstar, Generica, and TGP. So, meron po tayo niyan sa Bicol. Meron po tayong Southstar, meron po tayong Generica and TGP. At saka, meron din po tayo sa mga distributors natin. Doktora, bumalik lang po ulit. Meron po siyang sabi niya, third kid po, still breastfeeding at 2.5 years. At yun po, si Miss Ann, sabi niya, third kid na pala, hindi ko alam na pangatlo na, third kid na po pala siya, tapos 2.5 years old na po yung anak niya and still breastfeeding.
Anong kailangan? Vitamins. I think continue the supplementation, mamamayat ka ng husto. Breastfeeding itself, mahusay na pampapayat yan no, sa mga mothers na bagong panganak. Tatanungin ako, paano ako mamayat, doktora? Okay, the number one you do, magpasuso ka palagi at mamamayat ka. 3 kilos, mababurn mo yan through breastfeeding, exclusive breastfeeding. And the more so you're breastfeeding for 2.5 years, no, I think you need to take supplementation. Multivitamins, calcium, iron, take it regularly. Otherwise, naku, baka maging malnourished ka na.
Okay, I'm sure, Doktora, nasagot natin because it has been more than an hour already at punong-puno pa rin yung ating information that we've gotten from your presentation and our Q&A this afternoon. Doktora, na-mention mo lang kanina, ulitin ko lang po, sabi ni Doktora, wag po tayong matakot na pumunta o magtanong sa ating mga doktor, sa ating mga consultants kasi sabi nga natin, although yung ating COVID is contagious or we're fearful, no? Then again, yung fear shouldn't paralyze us. Tama po ba, Doktora? So, Doktora, pwede po ba naming tanungin yung inyong schedule sa clinic para dun sa mga nanonood sa atin para kung saan po nila kayo pwedeng maabot bago tayo mag-close?
Talastas ba yan? Okay. I don't hold clinics anymore in the hospital. I have my own private birthing home clinic in Muntinlupa. Kami pong mag-asawa, pediatrician po, and I also have my other colleagues. Dalawa po kami OB-GYN, doon si Dr. Martinez. May dalawa po kami pediatrician pa, si Dr. De Guzman, and also the husband of Dr. Martinez. So meron na rin po kaming IM doon. Actually, it's a small clinic but we try to cater everyone. Hopefully po, yung aking clinic nga po ay matagal nang naka-establish doon. So I really dedicate my time in my own clinic. I am active staff of the many hospitals here in South, tsaka dito po sa lugar ng Parañaque and Sucat. But my main seat is in Muntinlupa. At by appointment na rin po, even if by appointment, nahirapan na rin po kami to accept all. Kasi po talagang nung nagkaroon po tayo ng quarantine, naipon po lahat ng mga check-ups now they're coming back. And sana nga lang po kung matutuloy na naman tong ECQ from my lecture ngayon, at least aware kayo ng mga buntis na pwede naman po by phone call, pwede naman po yung check-up kung makamiss kayo ng every month. Sabi ko nga kanina, yung 12 weeks, susundan na yan 20 weeks, 28 weeks, okay na po yon. For as long as you're not feeling bad, tsaka nakaka-comply kayo sa pag-inom ninyo ng mga vitamins ninyo.
Ako, Doktora, salamat. Punong-puno talaga tayo ngayong hapon na to. Meron po ba kayo your last message to all our pregnant women there at yung mabubuntis pa in the future kasi mahaba pa yung quarantine? Ano po yung gusto nyong sabihin sa kanila, your parting words na hindi sila dapat mag-worry kahit may pandemic?
Okay. First, I would like to say to you na pagdasal natin itong ating pandemic, no? Sana'y matapos na, kaawaan na tayo ng Panginoon. Matigil na to, although mukhang matagal pa, pero sabi nga ni Presidente daw by December magkakaroon na tayo ng vaccine. In US, it's on the third phase of trial, no? Magkakaroon na rin po tayo dito ng babakunahan natin, naghahanap na sila. And by December, hopefully, from China daw, China, ang ating makukuhang vaccine. So sa mga pregnant mommies natin, be vigilant. Let's be prayerful. Yung ating pagbubuntis ay hindi maapektuhan, no? Kasi hindi lang po physical health mentally stress na rin po tayo ngayon sa panahon na ito. So lalo na yung mga mami na yan, nagkakaroon ng depression. Baka mamaya malungkot kayo ng gusto because of the anxiety, because of the fear na baka mamaya may nangyayari na sa inyong baby. Just put in mind na kung kayo na may merong check-up, prenatal visit, nagtitake kayo ng vitamins ninyo, you're eating the correct and the right amount of food, at saka po yung inyong environment naman ay healthy, don't feel bad. Everything will end up soon siguro, makapanganak kayo ng safe. At saka, I always remind you, when you are in term pregnancy, please stay at home. That's the best thing that you can do. Protect yourselves. Dahil pagka kayo nagka-COVID, mahirapan pong maghanap ng lugar kung saan po kayo papaanakin. Our hospital is already loaded, no? We try to separate the clean case at saka po yung ating mga COVID patients. Ang puntis po naman ngayon ang pinoproblema namin kung saan po siya papaanakin. Kaya po, stay at home. Always maintain your good hygiene. And even in the house, kung kayo po ay marami sa pamilya, the working father is going outside, tell him to at least talagang magmask even at home. At kung may mararamdaman po, mag-self-quarantine na lang. Avoid siguro kissing muna, hugging your children, lalo po kung kayo'y buntis. Again, I should say, God bless us all. Thank you.
Thank you, Doktora. Very well said. Lahat sinabi na ni Doktora. Salamat po. It is indeed a delight and a treat for everyone to be hearing you say all this, no, coming from somebody like you. Maraming salamat.
Salamat din, Grace. Salamat sa Pharmaceia Jimenez.
Doktora, sandali lang po, magpapasalamat din po tayo, of course, sa dalawang mommies natin na very busy rin po, but they took time to be with us. Salamat, Mommy Joanne. Thank you. Would you like to say anything to our viewers before we go?
Maybe just keep safe for those pregnant women. And ayun, take your medicines or vitamins seriously. Because yun nga, one way to prevent it is to keep yourself healthy and for the baby na rin. Ayun. Thank you, Doc, also for the information. And Grace.
Thank you, Mommy Joanne. Thank you to Daddy Jordan also. And thank you to Mommy Malen and to Mommy Denise, yung nag-bridge sa atin. And of course, thank you, Mommy Carrie. Mommy Carrie, are you still?
Yes, Ma'am Grace.
Yeah.
Yes.
Would you like to say anything before we go? We close.
Everything Dr. Delamer said, mentioned was really knowledgeable to everyone, and we're very thankful that we had this kind of meeting so that we will be able to help to scatter all the health teachings that we need. Maybe we just stay safe po, proper hygiene, and then right diet and supplements. Ayan.
Thank you. Thank you, Mami Kari. Sa lahat po ng nanonood, maraming pong salamat. We appreciate you for staying with us. We appreciate our doctor for giving us all this information. Maraming salamat po, PJC family. At tandaan nyo po, this is just our last episode. We will be going back next week for our 8th episode. We will be discussing about dengue. Alam naman po natin, mahirap magkaroon ng dengue ngayon, although this is already of the time ng dengue season, lalo na ngayong may pandemic. Sana maiwasan natin to. We will be having a special doctor also who's going to talk about dengue. She specializes in infectious diseases. So next week po, yun po yung pag-uusapan natin. So sana po you will be joining us again. And mayroon din po tayong representative from the local government unit kung saan po Sila po ang nagpapatupad ng mga DOH preventive measure tungkol sa dengue. So sasamahan din po nila tayo next week. Very timely po ito kasi dengue season na because it's raining. So again po, Dr. De La Merced, I couldn't say enough to thank you and how grateful our company is to you for joining us and sharing all your knowledge. Salamat po at maraming salamat din mga mommies at lahat po ng nakikinig sa atin ngayon. We'll see each other again next week. Keep safe, be safe. God bless po. Good afternoon.
Thank you. Thank you.